Alright. Now, please open it and write down your name on that. Yeah, just write down your last name and your first name and middle name if you have it. Do not need to write the venue and the test date because everybody knows. Okay? Just simply write down your name, your first name, middle names, or last names, but do not need to write venue and test dates because everybody knows. Okay? And put your signature. Alright. Now we come to part A, listening. So you know exactly the structure of it, and now we start it.
Occasional English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract. And you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Gordon. This is your first visit. I'll ask you some questions about your health and your last pregnancy.
Okay, doctor.
First, what do you do for work?
I'm a computer programmer. I work in an engineering office. I work 4 days a week, but when the baby comes, I'll work only 3.
All right. Do you have any health problems?
I sometimes get asthma, but not often. I use an inhaler when I need it. I'm also allergic to penicillin. It makes my skin red and itchy. I don't smoke. I eat a vegetarian diet.
That's healthy. Is this your first baby?
No, this is my second baby. My first child, Ella, is 3 years old.
Did you have any problems with your first pregnancy?
It was hard to get pregnant at first. The doctor gave me some fertility medicine. During labor, Ella was in the wrong position, so it was a breech birth. The doctor used forceps to help. After that, I had some trouble with with breastfeeding, but the midwife helped me.
And your husband, does he have any health problems in the family?
Yes, his father and grandfather had epilepsy, but my husband doesn't have it. He also has a daughter from his first marriage. She has Down syndrome.
I see. There are some tests we can do during pregnancy, like amniocentesis, to check the baby's health.
I don't want that test. It can be risky. I heard about another test called CBS.
Yes, CBS is another test, but it also has a small risk of miscarriage. It is usually done around week 10 or 12.
I understand. I think we won't do any risky tests. I'd like to learn how to prepare Ella for the new baby.
Of course. Here's a leaflet that can help parents.
Thank you, Doctor.
Extract 2, questions 13 to 24. You hear a GP talking to a new patient called Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Royce. Come in, please. I see you're new to our clinic.
Yes, that's right. My old doctor retired, so I came here.
All right. I understand you've had pain in your knee for some time. Can you tell me how it started?
Yes, it started as a strong pain in my left knee, around the inside part. I heard it when I tripped at work. After that, the pain got worse. I also felt small, sore lumps behind the knee. They hurt when I touched them.
I see. How has this pain affected your job?
I'm a painter, so I need to bend and climb a lot, but I can't kneel or climb ladders easily now. It makes my work very hard.
What treatment have you tried so far?
My old GP told me to do stretching exercises and to rest when it was sore. He also told me to use ice packs for the pain, but it didn't really help.
Did your doctor give you any other diagnosis?
Yes, later he thought it might be tendonitis, so he sent me for rehabilitation in the hospital. It got a little better at first, but then the pain came back.
I understand. What happened after that?
The physiotherapist said my muscles were very tight. He did some special massage, but it was very painful. Then I started to feel worried because the pain spread to my shoulders and elbows too.
That must be difficult. Are you sleeping well?
Not really. I often can't sleep because I worry about the pain. I looked it up online and I think maybe I have fibromyalgia. The pain is in many places now, not just my knee.
All right, Mr. Royce. From what you've said, I agree we should check that. I'll refer you to a rheumatologist to look into it further.
Thank you, doctor. I'll be glad to find out what's wrong.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dietitian talking to a patient. Now read the question.
Hello, what brings you here today?
I just feel like a failure. I've tried to lose weight so many times, but I always give up. I think people believe I'm just lazy or that I don't try hard enough.
I understand how you feel, but it's good that you came today. It shows you really want to make a change.
Maybe I just need more willpower.
It's not just about willpower. Being overweight is a medical condition, not only your fault. When people gain too much weight, the body and brain don't work together properly. Your body doesn't feel full, even when you eat enough.
So that's why I always feel hungry.
Yes, exactly. And when you eat less, your body tries to save energy, which makes it harder to lose weight. So remember, obesity is like other diseases, such as high blood pressure or asthma. You can manage it with the right help and treatment.
That makes me feel a bit better. I thought it was just my fault.
No, not at all. You're taking the right step by asking for help.
Question 26. You hear members of a hospital committee discussing problems in the X-ray department. Now read the question.
Okay, next on our list is the X-ray department. Nick, can you tell us what's going on there?
Yes, of course. As you all know, our X-ray department is very busy. We have 4 X-ray machines in total. One of them is in the fracture clinic. Last week, one of the other machines broke down. The tube inside it stopped working, so we asked for permission to buy a new part. But the paperwork is taking a long time to get approved. Because of this delay, we are using the machine in the fracture clinic for extra patients. Now that area is becoming too crowded and the staff are struggling to keep up.
So the main problem is the delay with the approval.
Yes, exactly. Once the new part is approved and installed, things should go back to normal.
Question 27. You hear a senior nurse giving feedback to a trainee after a training exercise. Now read the question.
it took you some time to find the CPR board.
Yes, I couldn't remember exactly where it was kept.
That's right, and that tells us something important. Before any emergency or training, we should always check where the equipment is.
Yes, I'll make sure to check next time before we start.
Good, and remember, the bed needs to be flat before you slide the board in. It only takes a few seconds, but it's important for safety.
Okay. Should I put the board under the patient myself or give it to someone else?
Either is fine. The key thing is that it's done quickly and correctly.
Got it. I'll practice finding it faster next time.
Question 28. You hear a trainee nurse asking his senior colleague about the use of anti-embolism socks for a patient. Now read the question.
I saw that Mrs. Jones isn't wearing her anti-embolism socks. I didn't ask her earlier because she was sleeping. Is it because her legs are swollen?
No, not this time. Her legs aren't swollen. We sometimes avoid the socks if a patient has severe swelling, but that's not the reason here.
Oh, okay. So why not?
Mrs. Jones told us this morning that her lower legs feel numb. She says she has no feeling there. That means there could be a problem with her circulation.
I see.
Until we check what's causing the numbness, we've stopped the socks and are giving her medicine to help prevent blood clots instead.
Got it. Thanks for explaining.
Question 29. You hear a vet talking about her involvement in the management of the practice where she works. Now read the question.
When I first started taking care of the money side of our clinic, I felt a bit lost. It was all new to me, and there were so many things to learn. I had to be very organized, especially with all the new medicines and treatments we use now. They all have to be carefully costed so we know how much to charge. It keeps me very busy, but I actually enjoy it. Checking stock and prices helps me understand how the whole clinic works. It makes me feel more confident about my job as a vet. My manager lets me handle this part of the work. He's always there if I need help, but mostly he trusts me to manage it. He's happy when I can find ways to save money.
Question 30. You hear a physiotherapist giving a presentation about a study she's been involved in. Now read the question.
Hello everyone, I'm a physiotherapist and today I'll talk about our small study on movement therapy for children who had brain surgery. We worked with 4 children who had operations on one side of their brain. They started therapy about 2 weeks after surgery and continued for several months, even after going home. 3 of the children improved a lot. They could walk and move their arms better. One child stopped the therapy early, so his progress was slower. This kind of therapy is usually used with adult stroke patients, so it was interesting to see good results in children too. We think this is important and want to do more research to learn how well this treatment works for younger patients after brain surgery.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Repeat your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a sports physiotherapist called Chris Maloney giving a presentation in which he describes treating a high jumper with a knee injury. You now have 90 seconds to read questions 31 to 36.
Hello everyone, my name's Chris Maloney. I'm a physiotherapist and I'd like to share a case about a high jumper I treated. The patient was a successful athlete in her 20s. She came to me with strong pain in her right knee, the leg she uses to jump. When she trained harder for a big competition, the pain got worse and she had to stop training. She rested for a few months, but the pain didn't go away and she started to lose confidence. She even thought about giving up her sport. When I first examined her, I found she had tendinitis around the kneecap and some swelling. I also noticed her hip muscles were weak, and the muscles around the outside of her thigh were very tight. That meant her knee wasn't moving properly. My first goal was to reduce her pain. I used massage to loosen the tight areas, and the pain reduced quickly. This showed that the problem came mainly from muscle imbalance, not from from a serious injury. Later, we talked about using tape to support the knee, but I decided not to. She was already improving, and tape can make athletes depend on it too much. She didn't need it. In the gym, we focused on correct posture and movement. She did easy squats and balance work, then step exercises with weights. The main aim was to use the right technique and build strength. When she was ready, I worked with her coach. We changed her run-up so she came in from a wider line and used less of a curve. That reduced pressure on the knee and ankle and helped her feel confident again. In the end, she returned to competition without pain or tape and felt like a new athlete.
Now look at extracts 2. Extracts 2, questions 37 to 42. You hear a clinical psychiatrist called Dr. Anthony Gibbons giving a presentation about the value of individual patients' experiences and stories in medicine. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Anthony Gibbons, a psychiatrist. Today, I'd like to talk about stories in medicine, what we call medical narratives. A friend once sent me a case about a man with panic attacks. For many years, he was depressed and used alcohol to cope. Decades later, he was given a new medicine called Zoloft, and after 6 weeks, he felt well again and lived a normal life. What impressed me most was that this story was published in a medical journal, not just told between doctors. I often see how real stories help people. When I wrote my first book about personality in medicine, many readers wrote to say they recognized themselves or someone they knew. Some said it gave them hope. Of course, stories also have limits. When I first wrote about the drug Prozac, I said that some patients felt better than well. Other doctors read my book and started expecting that result before any big study was done. So we must be careful. Stories can lead to wrong conclusions if we don't check the facts. Still, I believe stories have real value. Numbers and statistics can't show the whole picture. Stories remind us that patients are people, not just data. Even big studies, called randomized trials, are not perfect. The results depend on which data researchers choose to include. So, in some ways, even numbers can tell a kind of story. In the future, I hope doctors will use both stories and science together. Stories help us understand the human side of medicine and help patients feel understood.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.
Now we proceed to the next skill, reading skills. It's now 11:12, and it takes 1 hour for reading skills. So you are expected to finish at 12:12. Okay? 12:12. 1 hour from now. You can go back and choose resting test. Alright. So once again, you will finish at 12:12. Okay? 1 hour from now. Go.